Hello everyone, I am Dr. Zina, a full-time dentist. You have selected this video because you want to learn about the different X-ray techniques that are used in dentistry, including the Bitewing, Periapical, and OPG. Before we continue, make sure to smash the subscribe button in order to encourage me to do more videos. Let's start now. So starting with the Bitewing X-ray, from its name Bitewing, it's called like that because we ask the patient to bite on the film holder in order to take an X-ray. The indications are to detect or monitor the interproximal caries if the proximal surfaces of the teeth cannot be visually or tactically examined. That's only one indication, but we have plenty of others. Like if you want to detect if the patient is having multiple caries lesions, upper and lower, and we want to capture it in one image, so we can take a Bitewing X-ray. We can detect the crown, bifurcation, bone, part of the root, all these can be seen, but the periapical area or the apex of the tooth cannot be detected with the Bitewing. And how you can place it should be parallel with the long axis of the teeth. So your line should be parallel with the long axis of the teeth, and the color for Bitewing is a red ring color. Now, in order to differentiate whether this is a right side or left side, if the Bitewing X-ray started from 6, which is the lower first molar, then it is right side. If it is the opposite way around, then it's the left side. So starting with the image labeled A on the left side, is it left or right? Can you write it down in the comment section below for me? I will tell you that since it started on the 6s, which is the, or you can say the first molar, lower first molar, or lower second molar, then this is the right side. But for the B, it is the left side because it started from the first premolar. Moving on to the periapical X-ray. Why it's called like that? Because we can view the periapical part of the tooth, which is the apex of the tooth, can be viewed with the periapical X-ray. Okay, and most commonly we are using the periapical to detect if there is any endo lesions or periapical pathology or oral involvement of the systemic disease. Evaluating dental development as well, dental alveolar trauma, all these we can view it. We have two colors for the periapical. The yellow color is for the posterior teeth and the blue color is for the anterior teeth. And this is how you can position the anterior teeth. It should be as well, the line should be parallel with your long axis of the tooth. Each time the line should be parallel with the long axis of the tooth. Whereas for the posteriors, we are using the yellow ring, and that is the correct position for the posterior. We need to position it as low level as possible in order to view the periapical area of the teeth. Okay, and of course, the line should be also parallel with the long axis of your film. Lastly is the OPG, which stands for Orthopantomogram. Okay, here the indications is to help us to evaluate if there is any caries or pulp origin disease. It's just generally speaking, okay, not specific. For specific, you go with the periapical X-ray. Another indication is trauma assessment for tooth or jaw fractures, okay, or if for the third molar, if the patient is having third molar, okay. For the third molars, in order to see if it is mesoangular or distoangular or horizontal or vertical impaction, any of that. Okay, and TMJ assessment for disease, fractures, or dislocations, tumor or radical cyst evaluation, and as well for the pedo patients, instead of taking multiple X-rays, we can just take one full mouth X-ray in order to detect everything that is in his mouth. Thank you all for watching my video. Don't forget to press the like button if you enjoyed the video, comment down below, and subscribe in order to encourage me to upload more videos.